Good morning, ladies and gentlemen. My name is Dr. Tinesha Parbu, and I'd like to welcome you to another SADA webinar aimed at providing information and education regarding the dental profession to the public at large. This morning's webinar will focus on the relevant topic entitled, "What are my options when I am unhappy with my dental treatment?" We have the pleasure of hosting Dr. Kobus Barnard this morning. Dr. Barnard is the dental mediator at the South African Dental Association. He qualified at the University of Pretoria in 1999, and he holds a membership at the Royal College of Surgeons in the UK. He has also been part of the Risk Prevention Education faculty at Dental Protection since 2010. He practices dentistry currently in the Southern Cape with a special interest in implantology and conscious sedation. He is a SAMHSA accredited medical negligence mediator, medical legal practitioner, and an expert witness. Welcome, Kobus, and thank you for joining us this morning. Over to you.
Morning, Tanisha. Morning, everyone, and thank you for joining us this morning and listening to us for the next 15 minutes. So today's topic is really what can I do if I'm unhappy or unsatisfied with my dental treatment? So the first big question would probably be, what are the general causes of why a patient may be unsatisfied with their treatment? And I guess you can divide that into three broad categories. So first is if a patient is unhappy about the clinical aspects of their treatment. For example, if the patient experiences post-operative complications after their treatment, like pain or infection, and the dentist is unwilling or unable to diagnose and treat the complications. Then, if a dentist fails to meet the patient's pre-operative expectations, the patient thinks they would be able to eat a nice piece of steak with their new set of dentures, and now they hurt them when they try and eat and they lose. Or a patient thinks they might look like some celebrity after their aesthetic makeover, and now their teeth are painful and it doesn't nearly look as good as they hoped or expected. The second category is if there's misunderstandings about the cost of treatment or who would be responsible for the account, especially when there's third-party funders or medical aids involved. You know, it gets really complicated when there are multiple problems that needs treatment, and complications can arise during the treatment that require additional remedial treatment. For example, a dentist quotes a patient 8,000 Rand for a crown. And after the crown is fitted, the tooth develops an inflammation and it becomes painful, which is not an uncommon complication after a crown is fitted. The tooth now requires an additional root canal treatment costing an additional 8,000 Rand, not initially discussed or agreed. If the patient knew the treatment would have been 16,000 Rand, then maybe he or she would have decided to have the tooth removed instead. Another example is if an instrument separated or fractured in a tooth during a root canal treatment. Again, it's not an uncommon complication, but now the tooth requires additional treatment from a specialist to remove the fractured instrument. So then another problem is when there are medical aids or third parties involved. The medical aid authorizes a procedure like a crown, subject to benefits in the medical savings account. But by the time the crown is fitted, the medical savings account might be depleted because the patient's wife got some new glasses from the optician, and now the patient needs to swipe his credit card. So if he or she knew that they have to swipe their credit card, they probably wouldn't have proceeded with the crown. And then the last category is when patients are unhappy with the professionalism or the conduct of the dentist. And that's generally when patients experience unprofessional or unacceptable behavior from a dentist, like rudeness, ignorance, when they feel that they've been overcharged, or there's dishonesty or even fraud, things like that. Or when a patient thinks that a dentist is not fit to practice as a dentist anymore, or when they work in an unhygienic environment and someone might feel that this dentist is a threat to the public, things like that. So those are the three broad categories of why patients would contact the South African Dental Association. So what are the avenues they can pursue when you're unhappy with your treatment? So when a patient are unhappy with their treatment or how much they paid for their treatment, they only have a few different options. The majority of patients just leave the practice and find a new dentist that they can go to, and they might give their old dentist a bit of bad publicity along the way or leave a negative review on Google. Some patients communicate their concerns to the dentist or their staff, either by writing a letter or an email or by making a phone call. So when they are dismissed or ignored by the practice, or the practice is unwilling or unable to help, they can either contact the regulator of the profession, which is called the Health Professional Council of South Africa. I will say a little bit more about the HPCSA a little bit later, or they can contact the South African Dental Association. Both are free options, but have slightly different roles and approaches to resolve a complaint. The South African Dental Association established a voluntary complaints resolution service in 2014, available to the public and to dentists to help them resolve their differences as an alternative to more formal legal proceedings or the HPCSA. So at SADA, we offer this voluntary complaints resolution service, and we use the principles of mediation to resolve complaints. So I think before we go on, let's just look at a broad definition of mediation. So mediation is a process by which the dentist and the patient, together with the assistance of a neutral person, which is the mediator, try to isolate the issues and develop options, consider alternatives, and hopefully reach a consensual settlement that will accommodate their needs. So the aim is not to achieve justice, but rather to find the most workable, practical solution to the patient's problem. Mediation has a rich history as an alternative to legal procedures in the Japanese and Chinese legal system. It's been particularly successful in divorce settlements as an alternative to the legal system, and it's been used in the UK, in America, and Canada to resolve medical disputes for years. So the principles of mediation: first, it is independent and it's impartial. Then it's voluntary. So both parties can choose not to participate in the mediation or the negotiation, and they can abort the process at any time. There are no costs involved for the dentist or the patient. It is confidential, the process, and it's confidential on two levels. First, no information will be shared with a third party without the dentist or the patient's consent. But secondly, no information would be shared with the dentist or with the patient without the other party's consent. And then the negotiations and discussions are non-binding until the dentist and the patient comes to an agreement that's formalized in a document and signed by both parties. Only then it becomes binding. And the advantages of that is that it gives both parties the freedom to put ideas on the table without being judged or without it being formal. So the advantages of mediation is that the research shows that up to 70% of complaints in healthcare worldwide are because of miscommunication. So the majority of these complaints can be resolved through good communication. So through mediation, there's also the potential for relationships to be restored. It's not like that with the Health Professional Council or with legal proceedings, because some patients don't want to go to another dentist. Then through mediation, you can create options and solutions that are generally not available through litigation or through the HPCSA. So the service is a solution-focused service that focuses on the needs and the concerns of the patient. It takes generally less time, and it's of course a free service. So there are many advantages for using the SADA mediation compared to the other options available. And then of course the last option is to pay a lawyer to help you, but that of course have costs involved and is a much longer process to go through legal proceedings. So what happens when mediation fails? So mediation is not the answer to resolve every dispute between a dentist and a patient. If we are unable to find a solution agreeable to the dentist and the patient, the process fails. This usually happens when parties have different versions of the truth, or if the patient has unrealistic expectations, or when the dentist is unwilling to help. Then the patient has to use another form of dispute resolution, which will either be the health professional counsel, arbitration, or to contact a lawyer to represent them. So let's say a little bit more about the HPCSA, which is the Health Professional Council of South Africa. Any healthcare practitioner, whether you are a doctor or a dentist or a physiotherapist or a dietitian, must be registered with the Health Professional Council as a prerequisite to practice your profession. The role of the HPCSA is to guide the profession, but more importantly, to protect the public. So unlike the South African Dental Association, the HPCSA have the authority to impose sanctions and fines on practitioners and even suspend their registration if they find that the practitioners are guilty of misconduct. So this complaints resolution service that SADA offers was introduced in 2014, like I said earlier, and since then it's managed to resolve over 4,000 complaints by just offering good communication to the dentist and the patients through a neutral person. And that summarizes the role that SADA offers, or the option that SADA offers to resolve complaints between dentists and patients. Over to you, Tanisha.
Thank you so much, Kobus. That was really informative. I think it will give a lot of the members of the public some comfort in knowing that there are some avenues that they can pursue, not necessarily cost-related avenues, like you said, with legal action, but more along the lines of mediation and trying to resolve the solution amicably, So I think it is very informative for the public and just a great background knowledge for them to know going forward what they can pursue. So I see we don't have any questions in this webinar. So I think we're just going to close off the session now. If you'd like to say a few words, parting words.
Tanisha, perhaps we should just tell the public how to contact the SADA mediation service. So there'll be two ways. The one is to visit the SADA website, which is what is it, sada.co.za? Or
yeah, that's right.
Yeah, and there'll be a link to the mediation service which you can follow, or you can send us an email on dentalmediator@sada.co.za. That'll be the easiest to contact the SADA mediation office, and we'll generally respond to you on the same day.
Great. Thank you very much for the wonderful information, and have a great day further, everyone.
Thank you, Tanisha. Thank you, everyone.
And